If you are older and do not ejaculate, do so immediately, Urologist explains. Oh, Dr. Olivia, this message is for you if you've reached a certain age, perhaps past 50, 60, or even beyond, and have noticed a distinct change in your most intimate moments. Specifically, you might still experience the full intensity of pleasure, that peak sensation of climax, but find yourself wondering where the expected release of seminal fluid has gone. If this has happened to you, please know that you are not alone, and more importantly, you are not broken or fundamentally flawed. The immediate surge of fear or worry that might accompany this realization is completely understandable, a natural response to an unexpected bodily change. However, there's a subtle, often unnoticed pattern underlying this experience that many men don't recognize until it starts to repeat itself. Once you begin to understand this underlying pattern, the initial uncertainty that floods your mind can begin to recede because the issue transforms from a vague concern into something specific and crucially manageable. In this discussion, I, Dr. Olivia, a urologist with 12 years of dedicated experience focusing on men's vital health across all life stages, will guide you through what this change typically signifies, what it might sometimes indicate in terms of your overall health, and what a urologist's initial approach to assessment usually involves. Our goal is to move you from a state of guessing and apprehension to one of clear understanding and confidence. The experience of a full climax without the what is retrograde ejaculation. Accompanying physical release of fluid can be deeply unsettling. For some, it might have been a singular, startling event that instantly knotted their stomach with worry. For others, it might be a recurring silent issue that they've been keeping to themselves, perhaps tinged with a sense of shame or a quiet apprehension about what it could mean for their health. I want to emphasize right from the start that your concern is valid, and I am here to address it with seriousness and profound support. This change in your body is not an indication that your masculinity has somehow expired, nor does it signal an end to your intimate life. Rather than viewing it as a failure, think of it as a detailed message your body is sending, a message that simply needs to be decoded. So, please stay with me as we explore the often surprising causes, the critical warning signs you should be aware of, and most importantly, the clear, actionable, and manageable solutions that modern medicine offers to restore your peace of mind, bolster your confidence, and enhance your overall well-being. Before we delve into the specifics of what occurs when seminal fluid is absent during climax, let's take a brief yet essential look at the normal physiological process. Imagine your body's reproductive system as an exquisitely synchronized orchestra, each part playing its role flawlessly. The testicles are responsible for producing sperm. The seminal vesicles then contribute the majority of the nourishing rich seminal fluid, and the prostate gland adds its own protective top cause, enlarged prostate medications, alpha blockers, fluid. This combined fluid cocktail is then gathered and prepared within the urethra. When climax is reached, a specific series of powerful rhythmic muscle contractions propels this fluid mixture forward and out of the body. This entire event is remarkably rapid, a testament to the delicate and synchronized timing between your nervous system, various glands, and muscular contractions. It's vital to make a crucial distinction here, gentlemen. Climax and ejaculation are not the same phenomenon, though they usually occur as a single, seamless event. Climax is the neurological sensation of intense pleasure orchestrated by your brain and nervous system. Ejaculation, on the other hand, is the physical act of expelling the seminal fluid. For most of your life, these two events blend together perfectly, but they are indeed driven by distinct mechanisms. Our focus today, therefore, is on what is technically known as dry ejaculation, a state where a man experiences the full sensation of climax and the associated pleasure, but notices little to no seminal fluid being released. This is often described to me in my clinic as an empty orgasm. The discrepancy between what is expected and what is actually experienced is what fuels this worry. And I truly understand that. You've become accustomed to a physical manifestation of this event, but it is paramount to grasp that your capacity to feel pleasure, which is governed by your nerves and brain, can remain entirely intact. The changes you might be experiencing relate to the mechanical delivery system, not necessarily a loss of your fundamental virility. It simply means a specific component of your body's plumbing may have a discernible reason for this alteration. Before we count down the primary causes of this phenomenon, a quick pause. If you find this information valuable and believe it can help other men, please take a moment to hit that like button. This signals to YouTube that this content is important and helps it reach a wider audience. Furthermore, consider subscribing to join our growing community of men focused on proactive health and well-being. And I truly encourage you to drop a comment below and share where in the world you are watching from. It's incredibly inspiring to witness this brotherhood of men supporting each other, the impact of prostate surgery, TURP à laser, across continents. Now, let's break down the 3 most common culprits behind dry ejaculation. Understanding the why is your first and most crucial step toward regaining a sense of control. The first and most common cause is what we call retrograde ejaculation. Picture this. At the exit of your bladder, there's a small muscular valve akin to a gatekeeper. During the powerful contractions of climax, this valve is supposed to clamp down firmly. This action ensures that the sinal fluid has only one path to exit forward and out of the body. However, in retrograde ejaculation, this valve doesn't close tightly enough. As a result, the sinal fluid following the path of least resistance flows backward into the bladder instead of moving forward. You still experience the full pleasure and neurological sensation of climax, but because the fluid hasn't exited, it feels as though it's dry. A common and often non-alarming practical clue to this condition is noticing that your urine appears cloudier than usual immediately after intimacy. This is because the sinal fluid is now mixing with your urine in the bladder. The practical causes for this phenomenon are varied. It frequently occurs after certain surgical procedures involving the prostate or bladder. While these surgeries are often successful and medically necessary, they can sometimes affect the delicate nerves that control this crucial bladder neck valve. Additionally, retrograde ejaculation can be a known side effect of specific medications used to treat conditions like high blood pressure or an enlarged prostate. These medications often work by relaxing smooth muscles in the body, and unfortunately, this can extend to the tiny muscle that controls this valve. I recall a patient, a very proud and accomplished man, who was understandably distraught after a successful prostate surgery when he understood that his dry ejaculation was purely a mechanical alteration, like a traffic light that had become stuck in an open position, and that his desire and ability to experience pleasure were completely unaffected. He experienced immense relief. Our second major cause is duct obstruction. This refers to a blockage within the small ducts through which the sinal diabetes and nerve damage risks fluid passes from the sinal vesicles and other glands on its journey to the urethra. Biologically, the glands are still producing the sinal fluid as usual, but imagine these small ducts as narrow delivery pipes. If these pipes become blocked, the delivery vehicle, the fluid itself, simply cannot pass through. Consequently, the volume of fluid expelled drastically decreases or might even disappear entirely, even though production remains normal. The practical causes of these blockages can include the scarring that sometimes results from past infections, such as a severe untreated bout of prostatitis. Less commonly, small calcifications, essentially tiny stones, can form within these ducts and obstruct the passage. The practical signs of such an obstruction can be subtle. Some men report a new, mild discomfort in the pelvic region during climax. Others might have noticed over a prolonged period that the sinal fluid has become progressively thicker and less abundant. The excellent news is that many of these obstructions are treatable. They can often be cleared with medication aimed at managing inflammation, or, if necessary, through minimally invasive procedures designed to restore normal fluid flow. The third significant area that warrants investigation relates to eye hormonal factors, specifically low testosterone levels. Testosterone acts as the primary fuel for the entire male reproductive system. It's not just responsible for regulating sexual desire and sperm production, it's also critical for the optimal functioning of the prostate and sinal vesicles, the very glands that contribute the bulk of the sinal fluid. When testosterone levels drop significantly, the entire system begins to slow down. Initially, you might notice a reduction in the volume of sinal fluid. However, over time, this deficiency can manifest in other ways, such as a decreased libido, less firm erections, and a generally less intense sensation during climax. On a broader systemic level, men experiencing low testosterone often report increased fatigue, mood swings, and a noticeable "is it dangerous?" when to worry loss of muscle mass. The practical solution in such cases often involves addressing a condition known as hypogonadism, which is a treatable hormonal deficiency. If a simple blood test confirms the deficiency, carefully managed hormone replacement therapy can often restore not only better fluid production, but also improvements in energy levels, desire, and overall quality of life. It is a mistake to simply dismiss these symptoms as an inevitable part of aging. While most of the time these causes are entirely manageable, as your doctor, I must also address the critical exceptions. Dry ejaculation can on occasion serve as a red flag for a more serious underlying condition. This is precisely why paying close attention to any accompanying symptoms is absolutely crucial. You should seek immediate medical attention if dry ejaculation appears suddenly and without any apparent explanation, especially if it is accompanied by pain, the presence of blood in your urine or sinal fluid, fever, or a loss of sensation in the genital area. These are urgent signals that demand an immediate urological evaluation. Certain neurological diseases such as Parkinson's disease, uncontrolled long-standing diabetes, or in very rare instances, specific types of urological cancers can interfere with the complex plumbing or nerve signals involved in ejaculation. Beyond the purely physical aspects, we cannot overlook the profound emotional toll that this experience can take. Many men consciously or unconsciously equate the presence of sinal fluid with their sexual performance and overall virility. When it disappears, feelings of inadequacy, anxiety, and frustration can take root, leading to a cycle of avoidance. It's common for men to begin avoiding intimacy altogether, driven by the fear of being judged or of feeling somehow incomplete during sexual encounters. The emotional reassurance that is paramount in breaking this cycle comes from two key sources: information and open communication. Understanding that this is a physiological change, not a personal failing, can lift an enormous treatment options and solutions weight. Your ability to experience pleasure, achieve erections, and enjoy genuine connection does not solely hinge on the presence of sinal fluid. Your intimate life can and indeed should remain a vibrant source of joy and fulfillment. To bring this discussion to a close, I want to leave you with a clear, supportive action plan to help you regain control of this aspect of your health. Firstly, don't ignore it. Investigate it. A sudden onset or a progressive worsening of dry ejaculation warrants a visit to a urologist. Often, a straightforward medical history, a physical examination, and perhaps a blood or urine test are all that is needed to arrive at a clear diagnosis. Secondly, control the underlying conditions. It is vital to manage chronic health issues such as diabetes, high blood pressure, and cholesterol levels effectively. These conditions have a direct impact on the vascular and nerve health that underpins the entire ejaculatory process. Thirdly, and perhaps most importantly, break the silence. Speak openly and honestly with your partner, and of course with your doctor. Articulating what you are experiencing is not only liberating, but also paves the way for effective solutions. Remember, professional support, whether it involves adjusting medications, exploring specific treatments, or simply receiving accurate information, is your most powerful tool for restoring confidence and well-being. Urologist's final verdict. In summary, gentlemen, the absence of sinal fluid during ejaculation is not an indictment of your intimate life or a verdict on lost masculinity. It is a signal from your body that deserves to be heard and investigated with the guidance of a qualified professional. Understanding the root cause, whether it is mechanical, obstructive, or hormonal, is the crucial first step toward achieving peace of mind. I have witnessed countless men regain their confidence, their vitality, and their inherent joy in living after receiving a clear diagnosis and a tailored action plan. Your vitality is not measured in milliliters of fluid, but in your overall health, your sense of well-being, and your capacity to live life fully and connect deeply with others. Do not let doubt or shame prevent you from seeking the answers you deserve. Acting promptly can entirely transform your experience, restoring the security and intimate connection that you are entitled to. If you found value in this information, please consider sharing it with a friend, father, or brother. This knowledge can genuinely shift a person's perspective. Leave a like to help this message reach more men who might benefit. And subscribe to the channel, turning on notifications so you don't miss our upcoming content dedicated to men's vital health. Remember, your best years can absolutely still lie ahead of you.